It's puberty, a spike in GnRH, gonadotropin releasing hormone. Where is it made? The hypothalamus. Why is it called gonadotropin releasing hormone? It's going to stimulate the release of gonadotropins or gonadotrophs or gonadotropic hormones, whatever you want to say. So GnRH signals the anterior pituitary in specialized cells there are going to produce these two hormones. So luteinizing hormone, or we abbreviate LH because these hormones have long names. That's why we use abbreviations like GnRH, LH, and FSH, follicle stimulating hormone. So the two gonadotropic hormones are LH and FSH. So gonadotropic. So what does that mean? They're going to stimulate the gonads to release hormones, and they're going to have other effects in the stimulation of reproduction. So making sex cells or gametes. So luteinizing hormone, what does this do? So we have our testes here, right? Our nice blue testes. And luteinizing hormone is going to stimulate these cells here called Leydig cells. So we look inside the testes, what we have the seminiferous tubules, and the seminiferous tubules are basically lined with these cells called Sertoli cells that produce sperm. And then in between those tubules, that's why we call them interstitial cells. That's another name for the Leydig cells, interstitial cells. So they're in between the tubules. And these are the cells that make sex hormones in the male. So the tubules, right, those Sertoli cells there, they make sperm. The cells that are between the tubules are the interstitial cells or Leydig cells. And they're going to make hormones. So the Leydig cell is going to produce testosterone. And testosterone is an androgenic hormone. So we can't really say male and female hormone, and we'll talk about that here in a second, because, well, females make testosterone too, about 1/20th or so, right? That varies fairly widely. And men also make estradiol, and they're extremely important for proper physiologic function, like sex drive, libido, and a bunch of other physiological processes that we can touch on here for a little bit. So testosterone is an androgenic hormone. So what does that androgenic mean? It means it produces androgenic type effects. Okay, so what are those? So secondary sex characteristics like beard growth, deepening of the voice by thickening the vocal cords. It's going to stimulate skeletal muscle mass growth. It's going to stimulate bone density. It's going to stimulate red blood cell production. So men tend to have more skeletal muscle mass than females, higher bone density than females, and more red blood cells than females. Now, does that vary? Sure. There's women with more muscle than men and higher bone density than men and even more red blood cells than men. But in general, males are going to have more. And that's why you see, like on lab work, the ranges for red blood cells, hemoglobin, hematocrit for males are always higher than the range for females. Right? Should make sense. So that's the effects testosterone has. So secondary sex characteristics and all those other things with bone, muscle, red blood cells. Now, the interesting thing here is what's testosterone going to do? Are there other hormones? Because everyone says testosterone, testosterone, testosterone. No, it's going to convert into estradiol. It's going to convert into another very potent androgenic hormone that females don't have called dihydrotestosterone. And because it's a long name, we abbreviate it DHT. So what happens here? So testosterone gets converted into estradiol, which is E2, right? There's E1, E2, and E3. And estradiol, what does this do? Well, all kinds of important functions in the male. So first of all, how does it get converted? There's an enzyme, I didn't write that here, but the enzyme is called aromatase. The aromatase enzyme converts testosterone to estradiol. We see that in the female as well, because you've heard of things like aromatase inhibitors, which you might use in estrogen-sensitive breast cancer to lower estradiol levels. Males, it's used sometimes with testosterone therapy if estrogen gets too high to block some of the conversion of testosterone to estrogen. Not all of it, but some. And what is estradiol going to do for the male? Sex drive, libido, right? These hormones are going to go back to the brain and bind receptors and have neurocognitive effects, right? They're going to affect our cognition, right? If a male's low in testosterone, they might have depression, low libido, right? So that's low sex drive, right? All these things. Estradiol, the same thing. We need estradiol for proper sex drive and sexual function, right? We don't want it too high. We don't want it too low, just like all hormones, appropriate amounts at appropriate times, okay? So estradiol is important for bone health, right? It also stimulates bone density. It's also going to be cardioprotective. So it promotes a higher HDL, good cholesterol, like high density lipoprotein, and a lower LDL, low density lipoprotein. They have cardiovascular effects, right? That's why women who are premenopausal tend to not have as many heart attacks as men. Now, dihydrotestosterone is very androgenic. This is going to help with the androgenic, sex characteristics. It's going to bind to the prostate, so high levels could make the prostate grow over time. Not really cause prostate cancer, but make the prostate grow. It binds the receptors in the penis and helps with erection. Extremely important hormone. Okay, the enzyme that converts testosterone to DHT is the 5-alpha reductase enzyme, and sometimes we block the 5-alpha reductase enzyme. Why would we do that? Well, if DHT levels are too high, and we see that in BPH, there's lots of other drugs they use now instead because there's a lot of side effects of blocking that 5-alpha reductase. Men also use it for androgenic alopecia, so if their hair's falling out, because DHT binds to the hair follicle, and that can happen if someone's genetically predisposed to male pattern baldness or androgenic alopecia. So some men do that as well. But when you block it too much, well, men can have issues with erectile dysfunction, right? Because we need DHT for that. So what does FSH do? So that's the hormones here. FH is going to stimulate these cells. These cells are called Sertoli cells. Sertoli cells. And Sertoli cells are going to produce sperm. And you probably can't see that, but I drew a little teeny tiny sperm in there. Okay, so they're made in the Sertoli cells, and they go through all the things. They start with spermatogonia, then primary spermatocyte, secondary spermatocyte. They then go into spermatids and then mature into spermatozoa in the seminiferous tubules and then in the epididymis, and then through the ductus deferens into the body. Okay, so this is what's happening here. LH stimulating hormone production, okay, and FSH stimulating sperm production. That's how you need to know. There's some overlap and things like that. And of course, there's going to be negative feedback. So estradiol and testosterone, so all these hormones are going to have some degree of negative feedback on the hypothalamus and the pituitary. So if testosterone levels are high, well, it's going to lower LH and FSH. It's just to balance things out, right? It's a negative feedback loop. And that's why men take testosterone therapy, exogenous testosterone. The testicles say, hey, we have exogenous testosterone. We don't need to make, right? We don't need to make all this testosterone. So the testicles kind of shut down to a degree, which may be temporary. And then if we get lab work, we'll notice LH and FSH are low. They're very low because we have this testosterone coming in, and it's going to negatively feedback and inhibit LH and FSH because of this exogenous testosterone therapy. Okay, we won't get into all the details of that, but that is important to understand. As more patients are going to be on TRT, so we'll see that more often in practice. So you have to understand the effects of TRT. Other effects of TRT that could be potentially an effect that could be bad side effects. So increasing red blood cell count too high, making the blood too viscous. That can happen in some patients, but not all. We worry about infertility. Well, it depends on the amount of testosterone, the duration. But generally, men come off testosterone. There's medications they can take like clomiphene and HCG, which can help kind of get testosterone and sperm producing again, as well as recombinant FSH. There's another medication called HMG, all these things, right? Also, the growth of the prostate too. So the prostate can grow, but we know there's no evidence showing testosterone therapy will increase the risk of prostate cancer. And there's a great study that came out not that long ago showing that testosterone therapy does not increase the risk of cardiovascular disease. So those are really important things to understand. Okay, so just touch on that. We won't get into all the details on testosterone therapy, but it's important to understand those things when you have a patient on there. That's it. Okay, it's that simple. Next, we'll talk about female sex